So first, I just want to start off, and that's the logo for Healthy on the Move. It's a mobile app, a website, and a healthy healthcare magazine. And I do have another share here, and like I said, I'm going to be a little creative here. And we're going to share that one, and we're going to start the slideshow. Okay, so you see my agenda? Is that up there? Good. Okay.
Yes, I see it.
All right. Okay. So to welcome everyone, we're just going to go through some introductions since all of us are new to each other. And then after that, I'll give an overview of what the app is. If that is our product, is a mobile app. Well, I'll entertain some questions just kind of for the background so that we can kind of get you up to speed as to what it is you need to know from me, and if I can convey effectively to people about the app and specifically to my board. So we'll go through some questions there, and then I'll talk about the history and some financial projections. I'll talk about the next steps, and then we'll have some more questions. And then I think we just kind of open it up, and I allow you guys to lead wherever we need to go. So let's start off. And so here's our introductions. And I'm going to go to this next slide here. I'll read this first. So as I was saying earlier, Healthy on the Move is a mobile app, a website, and a digital magazine. It connects app users with health concerns, or and if they have questions, so that peer advocates and providers can provide education, support, guidance, and healthy living. We work with people with chronic diseases, and we help them and empower them to get access to healthcare in certain communities. And I just want to add something here right now with the new funding cuts and the agencies that I know that I've worked with before. They're losing all kinds of patient resources, case managers, solutions, mainly because of maybe the gender of the person who's receiving them. So there's no better time than now to launch this app. So I'm just going to go to the next one. End. Okay, so we're going to start off. And what I'd like to hear, if you can pick one of these three questions at the bottom, and if you're willing to share, have you ever had a health challenge or a health condition? What helped you most during that time? Or have you ever been a caregiver? So we're going to start there to kind of get to know each other. And I'm going to answer all those questions when it gets to be my time. So take it away. Don't fight over who's first.
Sure, I'll start first. As a quick introduction, even to my background, my name is Nural Shah. I'm a physician by trade. I'm a trauma surgeon and critical care physician. In 2020, I realized that healthcare was likely going to be the next vertical that got catalyzed. I went back to business school. Now I advise life science companies, both on the buy side and sell side. And I'm a previous founder way back in 2000, much to the chagrin of my Indian mother. I took a sabbatical from medical school to do that. And I'm a founder again. I do angel investing on behalf of Thai Atlanta, Charlotte Angel Fund, and I'm on the due diligence committees. I'm also a managing member for a special purpose vehicle. To get to the questions, specifically, have I ever been challenged with a health condition where I needed some of the frameworks that you talked about? I'm going through one right now, which is I had a root canal, I have a crown that's not doing so hot, I need a periodontist, and I've had to go through my network in order to find the right treatment, right person, and nobody knows what's going on. So totally agree with that. And interestingly, what helped me the most was my network itself. Someone in my network, and I'm blessed because I know the dean of the dental college in Augusta University in Augusta, that where I live, and he put me in touch with a periodontist who called me immediately and opened a special day just for me. But that was simply because I knew the dean. I can't imagine how horrible it would have been had I not had that. And have I been a caregiver? In fact, this week I am taking care of my 96-year-old grandfather. And man, it is challenging. I totally see how elder care can be a huge, huge issue going forward. So maybe that was more than 90 seconds of my time, but I will cede the rest to Rashonda.
Well, I don't think we had a time limit, but thank you for thank you for that information. Are you ready, Rashonda? Can you hear us?
Let me see if I can try to text.
Hi, can you hear me?
Yes, now we can hear you.
you now.
Hi, how are you? Let me turn on my camera. Sorry, one moment. Oh, it's giving me an issue. Let's see. Camera. 1 second. I'm so sorry about that.
Hey, there you are.
Hi, I'm Rashonda. I'm still working too, by the way, so sorry about that. So let's see. I will start off by saying that I've been in the healthcare field for 18 years. I am a nurse and I also have my own healthcare agency in Georgia. So I've been doing that as well. And also I'm a wedding planner. So I love to help people. I've been in the field for a very long time. And I guess one of the questions, yes, I have had issues with, have you ever been a caregiver? Yes. So I do that all the time. So I'm doing that now. And have I had a health condition that was a challenge? Yes, absolutely. When I was younger, I got hit by a car, I almost died. But I still have problems right now from like legs and things like that, and arms. Like when it rained, I have a lot of pain from that. But other than that, I am grateful and I'm blessed, and I'm just here to be a part of this. And I thank you so much.
Okay, thank you.
You're welcome.
Thank you. Thank you. All right. So I'm sure if Richard comes aboard, we'll get a chance to hear from him and to meet him. But so I'm going to introduce myself and talk about my why. My name is Barry Sermons, and I am a healthcare and civil rights advocate. And here's my why. We started this app years ago, and I'm just haven't updated all of that yet. But anyway, so I am 35 years clean and sober. And I do that. I was going to say did that. I do that through 12-step recovery, Alcoholics Anonymous, and other 12-step modalities, as well as I have been in mental health therapy. I had a therapist put me in substance use treatment 35 years ago. And I have been in consistent therapy since then. Most times, like now, once a week. There have been times where it's once a month, but we say I have about 1,000 hours in therapy. So if I was going for a certificate, I've got 1,000 hours in. I tested positive for HIV in 2001. And I started treatment a few years after that. And I've been at a point which we call virally suppressed. And this is really important because I have been virally suppressed. That means that I cannot transmit the virus to anyone else through sex. It's a phenomenon they call U equals U, which means undetectable equals untransmittable. That science has been around for a while. However, my wife and I didn't know that, and my doctor said he couldn't really say definitively, and that's because the CDC was years behind the Europe medical community, and they were touting the results and really embracing that concept. The CDC here and the United States were probably 10 years behind. Something important about why I tested positive in 2001 and didn't start treatment until 2003 is because back then there used to be this condition, and I guess you guys know this condition, health condition in the United States called pre-existing conditions. And I knew that once HIV positive was in my medical record, it was going to be tough for me to get health care. So I waited 2 years. I got a plan. I waited 2 years until the statute of limitations ran out, and then I went and got care. Every time I say that, as I speak in an HIV environment, I say I don't recommend that. But shortly after I got treatment, I became virally suppressed, and in 2013 I became an advocate. And I became an advocate because my wife, I was an entrepreneur. I've been an entrepreneur since I had a paper route when I was a kid. I had, corporate jobs, but I was always an entrepreneur. And so I became an advocate. My wife became sick. Well, actually in 2008, 3 things happened to us. The stock market crashed, and we were in the middle of a home remodel and an addition. She was let go by the law firm because the market had crashed. And remember, 2008 was a pretty scary time financially. And then she was diagnosed with breast cancer. So I became an advocate because we lost health insurance. And there was a program it's part of the Ryan White Care Act that provides services for people living with HIV. And there is a program called Health Insurance Continuation Plan. And on that plan, they would pay the premium for my health insurance. Well, in 2013, my case manager, which we're going to talk about case managers in a minute, my case manager dropped the ball and I lost my insurance. And I had to go through the Ryan White program as a person off the street who tested positive and didn't really have any resources. And I loved it when I had my own health insurance and I could just get my stuff and go home and not have to go into any agency where the name AIDS was on the billboard, or that people knew why people would go there. So, having said all that, I started Healthy on the Move out of being a caregiver. I told you my wife got breast cancer in 2008. She went into remission and things were great. She had, I think she had a surgery. She was stage 0. So we just knew it was no problem. Stage 0, whatever that meant. They went in and took out this little thing. They said it was smaller than a grain of sand. And then 4 years later, it came back. And it came back with a vengeance. And so in 2012, she had a seizure in the middle of the night. And so when we took her, we rushed her to the hospital. And in the state of Georgia, once you have a seizure, you can't drive anymore. So at that point, I became her caregiver in getting her back and forth to appointments. And I learned a whole lot more about her condition than she was really letting on. You know, I found out that she really was diabetic and she was insulin dependent. I didn't know that previously. I found out that she had some other conditions that she was medicated for, you know, and people don't always share what their health conditions are with others. That's why I appreciate, you know, you two being willing to share something about what, you know, what's going for you health wise. So anyway, so she became real sick real fast, and she became worse and worse each week. One of my craziest stories was they suggested that I put up the handicap ADA bars in the bathroom and in the bathtub. And it took me about a week to figure out how to do it and measure it out. And I got those bars in, and they were perfect and they looked great. And then 2 weeks later, she was at the point where she couldn't bathe herself anymore. So she didn't need those. And that was the whole caregiving experience. I would figure something out, and then she would get worse. I didn't have any support with caregiving. There was a group that I went to that was grief support, which was good to talk to other people, but I just didn't have any resources for caregiving. And I ended up hurting myself, and I had a hip replacement last year from this incident. I would transfer her from the bed to the wheelchair and from the wheelchair to the car by lifting her and swinging her weight and her body with my left hip. I don't recommend that either. So I blew apart my left hip and I had to get that replaced. So caregiving has been a challenge. I knew that there were solutions through 12-step and through other things I've done. In my 12-step group, there are 175 of us that meet every MLK weekend. And we meet specifically to support each other, and we are each other's network. And in that group is my best friend. He's been my best friend for 30 years, and we support each other through these things. He lost his son 2 years ago to blood cancer, and when my wife passed away, he was there helping me. So when she passed away in 2015, she was blind because the radiation, they gave her whole head radiation. They normally do this thing called gamma knife, which is real exact. They didn't do that. It burned her optic nerve. So I had to learn how to take care of a person with declining health who was now blind. My phrase about it, caregiving ain't no joke. You know, it's just really, really a tough time. So when she passed away, I said to myself, you know, there should be some kind of way that people who are going through issues, because I learned a whole lot about breast cancer, or who people who are caregivers, you know, I know what not to do. I don't necessarily know everything to do, but I know some things not to do, should have a resource to be able to take care of themselves. And I'll just add this one thing. In my age group, my oldest cousin Carol was diagnosed with stage 4 pancreatic cancer about 2 months ago. And I went over there to visit with them. And this is in the model of Healthy on the Move. You know, I went to see her, I hugged her and everything. And then my sister went back and they were talking. And I went to talk to her husband. And I said, what do you need? I'm going to be calling you once a week. And if you need anything, you call me and you let me know. Because I was going to be able to support him as a caregiver. All right. So that's just a little bit about me. I decided to create this app that would be the solution for people to connect with other caregivers, other people who have you know, who have dental problems, you know, other people who may have a family member who has substance abuse. You know, just, and these are the disparities that we've identified that are, what do I want to say, real prevalent at the time we put this together in the underserved communities. And there's a challenge with access to healthcare. Let me just tell you about the symbol and what it means. So this circle, I'm looking at the wrong screen for you. The circle in the middle is called the Four Blessings. And the Four Blessings is from Chinese medicine. It's for longevity, prosperity, virtue, and good health. The symbol of the three teardrops, which actually looks similar to the yin yang symbol, but it's a little different. I'm sorry, that's that. But the Tomaki sign, which that is, has the flames, which means the earth, the heavens, and mankind, and all those forces playing and interacting together. And the two people, some people say, some say, oh, they're dancing, and others say, oh, this guy is sick on the left and he transforms on the right. Everyone has a different opinion as to what they see there, but what I see is health and solutions. Go to the next one. So back in 2011, I had a mentor. I told you I've been an entrepreneur for a long time. And I had a business that was a mobile app creation business. We used to write and create mobile apps for businesses, like agencies, like the Food Truck Association of Washington, D.C. We created an app for them. 4 or 5 churches we created apps for. Health professionals, we created apps for them to track and send out information to their patients. And mind you, you both are healthcare professionals. Everything I'm going to talk about that we do, we're on this side of HIPAA laws. Okay, we don't cross over into getting personal information. We don't cross over into sharing that information. We're on this side of HIPAA. And so anyway, he had this concept he had been working for with some gentlemen out of DC, that they wanted to create this ecosystem called the Healing Drum. And this is back when, video on the internet was just becoming popular, and, they saw creating video channels, and they saw also putting monitors in office waiting rooms with, pre-roll of solutions and other people. So anyway, it was called the Healing Drum, and it was beating for healthcare literacy, which meant that, there was a cadence and there was a tone that people were being helped, or people were being taught how to take care of themselves. And so out of that, working with him and trying to put an app together for that, which never really got funded, I moved on. And so I'm just going to tell you about some of the people who have been on my team. I started this thing in 2015. And I started in 2015 and I launched the app and I was ready to go. And then Apple and Google, they changed the rules on how you publish apps. And they decided that, no, you can't have an app that looks similar to most apps. And the platform I used, it was a templated system. It was like WordPress is to websites. This system is to apps. And so they shut down the one company I was working with. And so I had to find a new app developer. And I ultimately did. Then I launched it again and the pandemic came. Now, had I launched it like a year before the pandemic, it would have been a great tool. So, but these are just some of the people I've worked with over the years. Bob Townsend, he worked in entertainment. He's worked for some companies, Wall Street Journal, the Home Shopping Channel. He was a big exec in Washington, the New York City area, working on Wall Street, and he worked with helping create video channels. Paul Plate was the founder of an agency called Positive Impact. That's where I was receiving mental health treatment for when I became HIV positive. Bonnie Sullivan, that's my sister. She's got an MBA in healthcare administration. She's worked for probably, I'm going to say, every healthcare company as an administrator, or she's a project developer now. She's installed computer systems. Matter of fact, she's working on a project with Kaiser Permanente at this point. And they just implemented some new a thing called Get Care Now. But anyway, so she's worked for Aetna, Blue Cross, Blue Shield. She's just been around. And so she and I worked on some things together. My brother, he teaches about, he's an adjunct professor for Carnegie Mellon, and he teaches about quality insurance and data analysis. Kevin Marshall, one of my cousins, he was a retired military. He helped when we were building apps. William Haynes, a guy I worked with, he worked with people who had substance use issues. Anthony Merritt, he was an advocate like me. And Reggie Smith, he's an advocate like me, and he runs an organization for couples. So let me show you the app now. See if I can unshare here. Okay, unshare. There's a stop share button here somewhere. There it is. Okay, now I'm going to come to my computer, see if I can start a share. Okay. Yeah, just go ahead and share this. Interface is a little different on. There we go. Share screen. All right, so now I'm going to switch over. So maybe I didn't click finish the share. We don't need to see me twice. Oh, okay. I have to give that. Bear with me, folks. Bear with me. I have to give this persona the ability to share. All right, this one. I don't think I can do that. So, Christian, could you give the second iteration of me the ability to share screens?
You need me to share the presentation?
Yeah, I want to share from the, I'm in there twice. Let me just rename it. Won't even let me rename it. Yes, so there are two versions of Barry S. Atlanta. Could you make sure that they both can share screens? All right, well. I don't know how to do this. Sorry, folks. Thought this was going to be
If you're going to debut the app, or give us kind of a walkthrough? Is that what you're trying to do, Barry?
Yeah, I thought I was just going to be able to just share the screen. I mean, I used to be able to do that, but
One option, just to kind of give us the customer journey, and I assume this is what you're attempting to go to, is just maybe put the app, if it's on your iPhone, mobile phone, whatever,
yeah,
up to the camera. Probably a not optimal, but down
yeah.
and dirty way where it gets the job done.
Okay, I guess I'll do that. Let me just go over to it and let's see how that looks. All right,
Okay.
well, there you go. So that's this is the app screen,
Hmm.
and what we have are in the top right. There's the healing directory,
Hmm.
and what this becomes is our list of providers, or let me see, what I call CAS, Community Advocate Street Team. And in your condition, when you had your health issue, your your dean actually was your cast member. Okay, your cast member, he had a solution for you, and he called somebody to hand you off to with a warm handoff. So he talked to you, he found out what your problem was, he knew of the solution, and then he called to give you a warm handoff. Okay. There are other things here. There's the network, and I'm just going to go ahead and talk. There's a network like a Facebook where people can share information. You download the app, you fill out a profile, and you decide what pieces of information, healthcare wise, that you want to see and that you want to get connected with. Then there is a listing of health providers and holistic healers and the like, um, based on geographic location. So, you know, if you're looking for a gas station in East Point, Georgia, or if you're looking for a healthy healer in East Point, Georgia, it's very similar. Um, it's a very similar interface. Okay, and then there's a listing of video content as well as you know, just reading material for each kind of condition that's out there. So the next thing that people typically will ask is, I'm going to just stop sharing. Typically ask is, so how do we make money, right? People have asked me that every time I was an entrepreneur. When I had my paper route, they asked me, how much money did you make and how do you do that? Well, I now have decided I wanted to turn that question around, and I want it to be not necessarily how do I make money. I want it to be how do I make a difference for people. I'm going to go back to my share here. How do I make a difference? Just going back to some of the iterations, this is when we first launched in April of 2018. We were inviting people to download the app. Then in March of 2020, we had a session where we were training what we call our CAST team. I've been a healthcare advocate for some time, and this is the floor when the Affordable Care Act was approved. I was actually in at that time. John Lewis was my congressman, and I was actually, when that vote took place, I was actually in his office that week. All right. There are 3 customers, and I just recently, by going through the Main Street trainings, I have found that there are 3 customers, and one's not a customer. It's called the app holder, and the app holder is a person that's trying to get services. Then we have the CAS team, which I call the Community Advocate Street Team. Those are people who are out there that you can call, like your dean or my friend John, that we can call and say, hey, who do you know that can help me with XYZ? And they're a non-paid, what we would call case manager, non-paid, non-medical case manager. And how that works is I would find out somebody needs something. And because I have been an advocate in the HIV space in Atlanta, Georgia for 12 or 13 years, and I serve on some boards, I know some places to go and I know some solutions. And so I would say, go down to agency A and talk to James over there. And I'm going to call James and tell James you're on your way. One of the challenges I had when I lost my health insurance is I had to take 4 trips back and forth to Fulton County Health just to get in this program called AIDS Drug Assistance Program, so I could get a monthly supply of drugs. And well, a monthly supply of medication. Let me clear that up. And so anyway, a warm handoff like you had with your root canal issue, and a follow-up for service, because I'm sure your dean's going to say, so how's your tooth? That's what the cast member's job is to do. And this week, I've run into cast members. Before, I thought I had to manage cast members, but now that I've been in the Main Street training, something that has happened to me that's really amazing. I moved into a new apartment complex. Somebody I knew from before, I found out he has a whole mission and been doing 15 years of training and events for veterans and mental health. And so he would become, well, he's becoming a cast member specifically for veterans health, mental health, and veteran services. And he will invite his friends and his providers, or his people that need services, to download the app. I also have run into a lady that has a passion for treating sickle cell. This has all happened this week, since I realized that my approach of having to touch each person, which was overwhelming for me. I thought I had to touch each person and download all the information. And I realize now that my job is to connect with people who also connect with people. And so we have those, we have the app holders, we have the cast members, and then we have the service providers or provider vendors. And those are the 3. And so how we make money is by advertising, underwriting, and grants. Advertising in the directory will give 3 or 4 months of free services, or free listings, and then $2, $3, $4 for a month to keep your listing active and access to the app holders. I'm going to stop there, and I'm going to listen. Any questions or any thing that I haven't been clear on right now that you would like to hear more about?
Sure. So we do have a little bit of time. Can you talk to me a little bit about the customer journey for somebody that decides that they're going to, start using Healthy on the Move as an app? Meaning, they're gonna, well, let me rephrase it. Let me ask you that question. What do you envision as the customer journey moving through that process? Does that make sense?
Yes, it does. So a person would have downloaded the app previously, or they would download the app specifically for this situation. And I'm just going to use you download the app and you say, hey, I've got a tooth problem and an issue. And you would fill out a profile basically with your name. It could be your real name, or it could be a name you make up. We keep anonymity. And then you would select that you'd want information, about maybe exercise and eating well and dental health. And then you'd go to the dental health section and you would say, connect to an advocate, connect to a support team person. I would like to talk to somebody. And that person could come on and just say, yeah, I've had a toothache before too. Yeah, I know how bad that can be. Maybe you want to go see a dentist. Or that person could be like your dean. And that's one of the cast members that says and takes you through that process. Then what would happen is that person would kind of own you and would follow up at the end and say, hey, how did that work out? If you had some other issue or some other condition or somebody you wanted to refer, they would log in, create a profile, and select the categories that they would like to be a part of. Does that help?
Sure.
It doesn't sound like it.
So, if I may, so as an end user,
Yes.
I'm getting specifically some, shall we call it, not necessarily a warm handoff, but somebody that's vouching. Your cast member is vouching for whatever service provider. Correct?
Yeah,
Like-
that is correct. I'm vouching for, yes, I've had an experience and I've been to this place, or hey, I've never been to this place, but I understand that they do good work. Go on over and talk to James at Positive.
Sure. And the cast member is not they're not paid or anything like that. They're kind of doing it out of community and such, right?
Yes.
And so your buyer, can you talk to me about who you think your buyer is?
Okay. So the buyer is, I served on the board of Positive Impact Health Centers for 10 years. And we used to advertise in different health journals and in different places. That is the buyer. They buy an ad or just a directory listing in the app, so that when you're perusing around as a new customer, you'll have access to that directory, that geolocated directory.
Got it. Okay. Now, if that's the case, so really, if I may, you're following an Angie's List model. Your Angie's List for healthcare.
Yes. Or Yelp. Yes.
Yelp, Angie's List started off as, hey, these are people that I've worked with, whatever, so, okay. And now, you talked a little bit about peer advocates
Yes.
early on. Now, they would be cast members, if I understand your model correctly.
Yes, that is correct.
Okay.
Peer advocate cast member. Yes.
Okay. So, based on the rubric, your customer is going to be providers, whether it be dentists, doctors, of that nature, right? So what have you learned about them in your value proposition for the customer?
Well, what I've learned by being in the community and the people who I've talked to since is that there's a challenge being connected to people who really need services or who are really committed to being served. And they fall out. They fall out of the cracks. They fall through the cracks pretty simply. If there's not a case manager or there's not a person there to guide them through, they fall out of care. That's one of the challenges that I found out from them. And the other challenge, like I said, I found out previously, is that they don't have the funding sources to be able to manage and to manage people's health. They're there for the 15 minutes that you're in my office and I write you a script, and and I'll see you, we'll set another appointment. And that's the model. So the better healthcare model is based on outcomes, not visits and prescription fills.
Okay. All right. Rashonda, please go ahead. I feel like I'm monopolizing the conversation. So if you have questions, please jump in. And I certainly have more, but I
No,
don't want
you're perfectly fine. I'm just listening and I'm very in tune with everything. So everything is fine. No questions right now.
to. Now, one of the things that struck my ear. So there were two things that I liked about the presentation, and one was I believe it was your cousin's cousin that you had talked to,
Mhm.
um, and I think you had said something like, "I'm going to talk to you all the time about what do you need,"
Yes,
right? It's something like that. I forgot the exact
yeah.
uh, phrasing of it, but I wrote it down. Um, would they be? Is there a way to put them as cast members once they're end users? Meaning, what's your plan to grow the number of cast members? Because what you're describing is the network effect taking hold,
Yes.
correct? So, can you
That is
describe
correct.
how to get more and more end users by having more cast members?
Mhm.
Because that ultimately makes it much more preferable for advertisers. Who's your raw customer? Can you
Yes.
talk a little bit about that for me?
Yes. There is that phenomenon of, wanting to help once a person receives some services, which is my case. But not everyone wants to to move forward to from what they say, hurting to healing to helping. The approach that I have not implemented yet because I wanted to get some traction first before I even approached. I haven't. I have access to a woman who is the director of the Breast Cancer Association of Georgia. I would connect with her and ask for a list of people who have been through breast cancer and who want to help other women with breast cancer. Um, One of my good friends, he is the president of the Alzheimer's Association. I have not asked him because we just buried his dad about a month from complications of Alzheimer's. So, and I ran into the friend I told you that works with the veterans.
Hmm.
So I'll work with people who are working in organizations that have that common focus and have a group of people who, they go to the walks, they donate every year to the campaigns, and they would show up to help a friend in need or a person in need. And so you're asking for the critical mass that would make somebody want to keep their ad there. If we were connected and there was a listing as a cast member, it would be the American Diabetes Association and the Georgia Breast Cancer Association and the Atlanta Alzheimer's Association would be the pool of people that we would connect with. Does that
Okay.
sound does that sound problematic?
Sure. Sure. So, it doesn't sound problematic. But then in terms of customer segment, first let me rephrase it into end users and users of the app where they're going to find value, and the customers. The customers, i.e., service providers, dentists, health advocates, HIV advocates, social service advocates, all these things, and they obviously have access to money, whether it be grant money, municipality money, all sorts of other things. Then you have the private providers like dentists, doctors, um, what have you. So
Mhm.
those are the customers. Now I'm going to leave that out for a minute. If you focus on the end user, and quite frankly, the end user is going to be the person receiving help, but they're going to rely on the cast members. And so, if I can break it down into my little shtick, they're almost like your employees, right? YouTube, the reason they get videos is people are uploading videos and then everybody watches those videos and then the advertisers come in as a result. Like that's what you're doing, right?
That's correct, yes.
Okay. So on that score, how what beachhead do you envision attacking first? So, for example, you did mention the HIV space, then you mentioned the breast cancer space, then you mentioned substance abuse space. Obviously, there are a lot of those things. If you go back to that slide with health
Mhm.
disparities amongst African Americans, and as a physician, and I'm sure Rashonda as a healthcare provider also knows this quite well. We know that that exists. Right. And what's also been shown, and this is something that you may want to lean into, is that the medical data around compliance, meaning are they, you may get the right treatment, but you won't take the treatment that's been given because if they don't trust the provider, they typically won't be compliant. And I remember in medical school and even afterwards, that's why, like, for example, African American patients prefer an African American doctor, even, as opposed to like a Caucasian doctor, because their compliance actually goes up, with an African American doctor. Right. And that makes sense. Like, my parents are Indian, they go to an Indian doctor, they say it, and then all
Mhm.
of a sudden
Yeah,
they take it all the time,
yeah,
whatever.
yeah.
So, that here's some a little bit of thought just for you to think about is one, create the beachhead that you would go after, because you may, wherever your network is the greatest, just as an
Mhm.
example, you're an HIV advocate from my understanding,
Yeah.
say I am just going to rule this market first, like, and it's going to be in Atlanta, and it's going to be, and it's very easy for you to lean on cast members that can first come in. Then obviously HIV has adjacent things, right? Typically HIV and substance abuse kind of go together. There's a correlation, obviously
Yes.
not causation, but correlation. Then you can say, I'm going to add this next. Breast cancer is a little bit tangential, and so have a beachhead that you're just going to rock. And then go to the next little bit that's adjacent. Then go to the next little bit. And what happens is that then those cast members become entrenched in that position, right? Which means more and more people come on, and then you can just keep moving to the next little bit. So if that were the case, and I don't know if you had thought about that before, where would you, in the between now and the next board meeting, what would you say would be your first three calls with the proposed use of funds?
My first three calls are to, there's a group I'm a member of. It's called Straight and Positive. There
Mm-hmm.
are 80 members around the country. We have actually been approved to do a workshop about straight men and HIV at the U.S. Conference on HIV/AIDS in September. So I'm talking with the brothers there, the ones who work for different agencies. One works in New Jersey in an agency, and one's in upstate New York. Um, and so my call would be to them. They know about the app, and I've been telling them that we're gonna take this thing. We're going to take this thing to market soon, and they've been waiting for me to get back to them. And then the second call would be to my friend Gannon, who's the Alzheimer's Association. But me, yes, that's my wheelhouse: health,
Sure.
mental health, substance use, and HIV. And just one second. I told you I just installed my computer and everything's cool. And I put in a battery backup. So we're talking on battery backup, right? The power
Yeah.
just went out in my whole neighborhood. If you lose me, that's because the battery ran out. So
Okay, no problem.
yeah, just letting you know that, just in case, I disappear all of a sudden.
No problem. So can you talk to me, and Rashonda as well, like both of us, can you talk to us about your proposed use of funds until the next board meeting?
Well, I'll show you what I'm just gonna show you what the funds are for. The website hosting is $15 a month. The app hosting fee is $125 a month. And there's a constant contact account that's associated with $20 a month. So we're about 100 and let's just say $150, $175 a month is what I've been putting into and maintaining. And that's mainly where I need to focus. And then I would focus on getting enough customers. If I could find 30 customers to pay $5 a month to run their ads, or 60 customers to run $2 a month, that would cover the point to where I could be cash flow positive.
Sure.
Quick. And so that would be the first goal, is to utilize the funds to make the payments, and then gain enough traction to have those payments paid by the
Sure.
revenue.
So if I were a customer,
Mhm.
i.e. a buyer as an advertiser, what metrics would you show me to get me to sign on?
Of course, I would show you the number of app holders, and then secondarily, I would show the metrics behind the searches based on what conditions people are looking for, and the questions that people are asking within the message board.
Sure. So I think in the terminology within the web space or software as a service space, they're typically looking at daily active users and monthly active users, right?
Okay.
Not necessarily app holders. MAU and DAO, as it's called. Okay. Do you have any numbers right now on how many people are using Healthy on the Move?
I personally have gotten 106 downloads.
Okay.
And yes, so the app is in 106 people's hands, and there's not enough content there that people don't always go to. That always go to the app.
Sure.
As I put new information out, I send a push notification. I've been writing articles about healthcare, and I say, hey, take a look at this article. Then they open the app and go look for it, and that's how we, that's where we encourage app usage.
Okay. All right. Rashonda, please go ahead. Again, I feel like I'm monopolizing the conversation, so I'll let you ask questions as well.
No, I honestly don't have any questions at the time.
Okay. And then I think, let me just make sure I got the amount ready so that I can make sure that we're staying on time. So we just have a couple more minutes. If you can go back to your team slide.
Yes.
Those would really be advisors, right?
Yes.
That's the point.
Let's go back to the slide. One behind. Come on. This.
Yeah.
Okay.
So out of that group, as you start to think about the team and bring it to the next level, I like that you had said to take it from being financially profitable to, quote, how do I make a difference, I believe is like the way you phrased it.
It is.
And so you'd be running it just to be cash flow positive, and then everybody else can they're just kind of helping because it's the nice thing to do, and like it's good, right? If that's the case, then what teammates or what holes in the team do you need to get from here to cash flow positive?
The big challenge with moving forward is the time for somebody to manage the day-to-day clerical stuff with the app. Adding new, every time I add a new.
Uh-oh, hopefully he didn't it may have gone.
Okay, can you still hear me? I switched back.
Yes,
over
now
to
now
my
I can hear you. You're frozen on your other deck, but
Yeah, that's because the power, the battery backup died.
no problem.
So, okay, so help me out. Where was I? Because I was getting frantic there for a second. I was answering a specific question.
My question is, what team would you need, and more specifically,
Oh.
what holes do you envision on your journey to becoming cash flow positive?
Okay, so I've always envisioned it having a team that would be a clerical team that would take the information from the new subscribers, the new cast members, the new businesses with their logo, their information, scrape their website, and create a profile for them. Then turn it over to them, and they run it themselves. That's something that's a manual process to do. And the other thing would be to call around or obtain new cast members in different genres, if you will, or different conditions. However, lately with the new AI tools that I've seen around, that necessarily does not have to be a person.
Mhm.
There is a CRM system called Go Vertical that I've been working with, and I think it would be perfect in that the AI with inside would, once somebody calls or sends an email, it would determine what path and what other follow-up information they would need to move forward. So I would need a person, maybe a part-time, 10 hours a week person, or the ability to build out this AI system. Go Vertical, it's called. Um, and 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 that Go Vertical is $275 a month. And then
$275 a month. Okay.
yeah. So and once the logic is built in, and the follow-up contact information is done, then it automatically goes on autopilot, and then I can focus on building within, and that's strengthening the people, finding, doing some online seminars on, what's the best way to work with somebody who's in crisis, what are the crisis, options that are available so that cast members can be effective.
Okay. All right, I understand. I think we're getting close to our time for the board to kind of step back and revisit, I guess. Christian, would you be able to put us in a breakout room? What's the current situation? Okay. Do you want to connect back in, Barry, in about 10 minutes? Give Rashonda and I just a few minutes to kind of confer, and then you can come back in. That way it'll be.
I've got 4:09. I'll come back in at 4:20.
Sounds great. Thanks. And that'll just give us enough
Okay.
time to go through
Okay.
what we need through.
Good enough.
All right. Thanks.
Okay, I'm back.
All right. So I will make sure we get out on time and everything like that. Barry, how do you think you did first and foremost, before I even give you our feedback?
I obviously could have done better in that I tried to do the old drink through a fire hose which I often, which I often do. And I had some real clear, concise videos that I could have used that took like 3 minutes each. Yeah, and based on your questions, I see there are some areas that I could have been better prepared for.
Yeah. What things do you think you did well, and what things? Well, you told me what you could do. Specifically, what things did you do well? What things would you like to improve on the next time around? Or would you tell someone else that's going through the Main Street Entrepreneurs Fund cohort 6? I think we're cohort 5, right? Hey, I would focus on this on the first one, and so on and so forth.
Yeah, so yeah, what I would have done differently is just present what the concept was, presented the idea, and then allowed the to be more of a conversation than a presentation.
Okay, what do you think you did well?
I think I have passion. I think I was able to answer, the questions that I did, that you did pose. Oh, another thing, I would have put together a presentation specifically for the board meeting, not the normal presentation that I just show people that are interested in the concept.
Great. So you're 100% right on everything. I think you're beating yourself up a little bit more than we would ever beat you up, which is always a good sign, right? People that have no self-awareness think they kill it, and like they don't. People that do have self-awareness are like, oh man, I could have done this better. I could have done this better. I could have done that better. I think, I'll speak on behalf of Rashonda and I. We spoke earlier. I think your passion came through loud and clear. I think your ability to take what you've gone through from a hardship standpoint to say those with others in hard positions, whether it be HIV, mental health, substance abuse, would be well served by you as their mentor, even potentially guiding light in a lot of ways, right? So I think your passion came through very clearly. And in fact, I would lean on it more. Okay. The things that you said that resonated with me, right? Normally, when I'm doing angel deals and things like that, these guys are looking at valuations at a minimum in the 7 figures, right? And they forget, how do I make a difference? And really, what you're describing is something that's going to hold up the test of time, which, given enough time, one of my favorite quotes from Dr. King is, uh, the arc of the universe is long, but always bends towards justice.
Yes.
Right? So you're playing the long game, and you're okay with that. And other people are going to be okay with that. Right? So I felt very comfortable. You could have leaned on it even more, like, hey, we want to be cash flow positive. We're playing an infinite game, not a quarterly game. So that was really, really good. Areas that I would assume, like, next time you can do a tiny bit better on is you can have your full deck, but you can, kind of put, add a little bit on certain things, take a little bit out for various groups, whether it's a buyer, whether it's a investor, or even like at some basic level a collaborator, contributor, right? And there are various different groups, right? When you ask a cast member, hey, would you like to help me with this, like, they're going to ask you, like, what's the start, like, what are you talking about, right? And they're fundamentally different. So that's one area that I think, and it doesn't need to be too big an improvement. That's an easy doable. Another thing I would potentially recommend, I saw that you were a video producer in your last life and so on.
Yes.
And take a really good video of you scrolling through, like, make a script for yourself, read it to yourself, so you click on the individual video modules, or the individual pieces of the app, so that you're voicing live what's going on in the video. So there's never such a thing as, oh, it didn't work. I don't know what happened, this, that. But, you can also have control over that video. Like if someone says, hey, wait a minute, what happens if you do this? What happens if you do that? You can pause it and say, oh, in this version or in this little subset, this will take you to a different, walled garden, what kind of thing. So 45-second video, it's easily placeable into YouTube, TikTok, whatever, IG type stuff, whatever platform you want to use. But on an investing pitch, it can kind of help gain notoriety. One of the best things that I would say is it's very hard to grasp abstract ideas for investors. And I love it when someone says, oh, I just helped a group from GSU, Georgia Tech, and Georgia. There were 3, engineering student females, and they want to do an at-home cervical prep kit or a cervical cancer screening kit, right?
Mhm.
And one of my main classes in investor relations at HEC Paris, he said something that's always stuck out. If you can link it to something else, we want to be these girls said, we want to be the Cologuard of cervical pap smears. All of a sudden, every investor understood exactly what they mean because everybody knows Cologuard, right? Like it's an at-home testing kit for colonoscopies. And boom, it's going to be whatever. And that's why I wanted you to think about, are we the Yelp of this particular thing? Are we the Angie's List of this particular thing? Right? And then everybody would get it. Okay? So that's one other area. And then the last thing is we're going to propose that you get some money. I don't know if we're supposed to tell you or like what the scoop is. I guess maybe not. I don't know. I won't tell you, but it'll at least be a few months runway time, and I'll let you. Okay. So you'll have
Thank you.
based on your current cash burn rate. What I would like to see at the next board meeting is you figuring out a tiny bit more the end user, because the buyer may or may not be there, and you may find buyers in unlikely places, meaning nonprofit groups that are given money by philanthropic organizations that want to get the word out. So they're not really a provider as such, right? They just want more HIV awareness within a certain group. One of the things that you leaned on early on was the spiritual nature of your journey. And I think there are churches and other things that are large enough where they could become your partners as cast members, right? And they may say, hey, we're going to give him $5 a month, just to say, this is coming from our church. God loves you, whatever, right? And these are unlikely customers, so to speak. So maybe think about who that persona of your buyer is going to be. And the way I think about it is I know you're a GSU student, and I also saw that you made the president's list. So I'm sure you know this, but I'm going to preach it once more to the choir, which is if I'm a winery, my end user is the drinker, right? However, my buyer is Publix, Kroger, Walmart. I'm not really selling directly to the end user.
Right.
I'm actually selling to Publix, Kroger, Walmart. How do I get Publix, Kroger, Walmart to buy me? I make a wine that everybody really likes, right? Like that's the point. And it could be various things, bottling. It could be, hey, I have wine enthusiast, a bunch of things. So understand the definition between the two. And so if you can bring up your MAUs and DAOs, like your daily active users, monthly active users, things like that, then a buyer, someone that's going to input it more, is going to potentially drive it a little bit more.
Right.
I loved your enthusiasm. I liked, where you were going with it. And I did feel like this is a worthy cause, certainly, that the proposed solution is actually quite right. In that, um, in the African American community, and I'll actually just more call it marginalized community. I won't just say African American community, marginalized community. Now that may be substance abuse, mental health issues,
Mhm.
HIV. These are all marginalized communities at some basic level. The micro targeting is worth more than a thing on Yelp or Google or Angie's List. The micro targeting of, hey, I know someone, I know what you're going through, is going to be very helpful. So the proposed solution that you're giving is quite right. But pick a beachhead, own that beachhead, and then expand outwards. And you are absolutely right. That fire hose, you've got all the passion of a great entrepreneur, which is you want to do everything for everyone. How about you do one thing for someone really good? And one of my mentors, when I did my first company, I was still, a student. He said, you want to be a machete, you want to think about machete engineering, not Swiss Army knife. Okay? A machete can be used to spread peanut butter. It can be used to shave. It can be used as a screwdriver, right? It could, but it sucks at all of those things. But what it does do, which is slice a coconut, it does amazing. And so everyone in the tropics must have a machete.
Yeah.
Okay. So think about machete engineering. And if I were in your shoes, I'd be like, hey man, I know the HIV space, like it's going out of style. I know all the people there. I can get cast members. I can make a difference. That would be
Mm.
your beachhead market. And you just own it. Like everybody in the greater Atlanta area would be like healthy on the move, or whatever
Mhm.
the iteration is going to be called, is going to be this. You may have your dream somewhere really, really big, which is great, but own this first little plot of land, and then you're going to keep expanding onward and onward and onward. And before you know it, people end up coming to you and saying, hey, we'd love to partner with you. We know substance abuse is a big deal within the HIV community. We want to partner with you. And then all of a sudden you start moving in a direction where it's like HIV, substance abuse, mental health issues. You know what I mean? Those are
Mhm.
all correlated. And then you just keep moving onward and out. But those would be my things. Is there any specific feedback that I can give you or Rashonda can give you?
Um, no, this has actually been helpful. Any feedback I would have asked for about what I could do better, and am I on track? You answered. You answered those things. I have a list of to dos before our next board meeting.
Yeah, and that's okay, right?
Mhm.
I mean, you're not gonna, this was our first one. You're not gonna know everything. You're not
Mhm.
supposed to know everything. I don't know everything.
Yeah.
And you can keep learning. And so those would be the things. Now, did you get the rubric that you were supposed to follow?
I did, yes.
Okay. I can't tell you this enough. Read that thing up and down, left and right, answer all the questions, spoon feed it to any investor. Most investment groups, when you look at like the Charlotte Angel Fund, Thai Atlanta,
Mhm.
which are the two big groups that I work with. Okay.
Yes.
And through there, then we work with like Atlanta Tech Angels, GSU, it's all one group. Like this number of people that I see from one group to another group, it's like 50-50. You know what I mean? It's one big
Right, right.
cabal that like runs the show.
Mhm.
Okay. We have like a thing to tell investment ideas. Like, this is what we want to see. Like, please give it to us. And you'd be surprised how many people don't give it to us. You're like, why don't you just read the 2-page thing, man? Spoon feed it to us. Make 10 slides that go through every one of those. And investors are super, super lazy generally. Many of them aren't thinking about, what am I going to have for lunch? Ah, crap, I need to make, travel arrangements, whatever. Spoon feed it to them based on that rubric. So you get zero, like tens on all of them because you explain the questions. And one of my mentors said, a investment meeting is like wrestling. Okay, you either learn to fend them off or you get on top first, and it's much easier to get on top first.
Mm. Good deal. Good deal.
Okay,
Yeah, this
I
has
know
been.
we're at the
Yep.
end of our time. We'll see you at the next board meeting. Read that rubric. You've got some work to do.
Okay.
You have my information. I think you have Rashonda's information. If you have any questions in the meantime, if there are ways that we can help you, I'm not in the Atlanta area for HIV or people in my network, but
Mm-hmm.
certainly if I hear of people, I will potentially do it. And one last thing, you may want to think about getting a hold of the team member that was the payer for Aetna, Blue Cross Blue Shield, Kaiser, I believe,
Yes.
because they have a very large vested interest, like from their company standpoint. If they can get compliance on HIV meds, and I'm thinking again just HIV
Yeah.
meds, their bottom line gets better exponentially. So
Yes.
that may be someone that's like, hey, would you be able to introduce me to someone that would be willing to fund it from their foundation? Like Kaiser has its own foundation, and going after them to multiply it through the Main Street Venture Fund. Just a thought.
Okay. Wow. That's a lot to think about.
Yeah.
Yeah. Several of the agencies in Atlanta, they have 340B programs.
Yep.
And yeah.
And they're not providers, right? Like they're not a doctor as such.
No.
But they have money ready for you, and you may be the one that gives them that little area that you're not, and give them something that beachhead is yours. You got it. Given enough time, you're gonna own it.
Yeah. You've inspired me. Thank you.
Okay, good. Good. All right, Barry,
Okay.
Rashonda, have a great day.
You too.
Bye-bye.
Have a great day. Bye-bye.
All right. Thank you.
You're welcome.